Good afternoon and welcome to this afternoon's meeting of the Perth and Kinross Integration Joint Board. You're all very welcome to participate in the meeting, the members present, and also welcome to members of the public and any media who are also present. Just as a very brief introduction this afternoon, can I just highlight a couple of housekeeping matters first of all. Firstly, we will take a comfort break at some point during the afternoon. That will be determined by concluding a piece of business. We won't interrupt a piece of business clearly, and we will attempt to take a comfort break between 2:30 and 3. Can I just ask everybody participating in this afternoon's meeting, recognising as ever a lengthy agenda, that questions and answers please as concise as possible. Those officers who are presenting reports will give concise introductory comments and that will facilitate as much time as possible for members' questions and answers as appropriate. Can I also emphasise that the Integration Joint Board is of course non-political. That is all the more important today. We are in a pre-election period, and so I would ask please that all members ensure that no political comments or statements are made during the course of this meeting. So without any further ado, if I can pass to Scott Hendry, and are there any apologies, Scott, please?
Thanks, Chair. Good afternoon, members. We've got apologies today from Lynn Blair. We also have apologies from Bernie Campbell, and we have Maureen Summers substituting. We have apologies from Alan Drummond, and we have Lindsay Glover substituting. At the moment, we have Bob Benson, who is having some technical issues joining the meeting, but we're hoping that Bob will be able to join soon. So I'm happy, Chair, to do a quick run through of the members that are present to check everyone's here. And if it's okay with yourself, I've got a short membership update I'd like to do at the end of that, if you're content.
Yes, absolutely. Off you go. Thank you.
Okay, so if I call out your name, if you can just confirm that you're present. Councillor Duff.
Present.
Councillor McDade.
Present.
Councillor Purvis.
Present.
Do we have Bob Benson as yet? Don't think we have Bob at the moment. Ronnie Erskine.
Yes, present.
Pat Kilpatrick.
Present.
I believe we had Dr. Norman Pratt, who's a proxy member for the current vacancy, was in attendance, but I think he had to leave, so he may return if he's not returned already. Gordon Patterson.
Present.
Jackie Pepper.
Present.
Jane Smith.
Present.
Dr. Lee Robertson. Don't think we have Dr. Robertson. Sarah Dickey.
Present.
And do we have Maureen Summers?
Present.
And Stuart Hope. Don't think we have Stuart. Sandy Watts.
Present.
Sandra Auld.
Good afternoon, present.
And Lindsay Glover.
Good afternoon, present.
Thank you. So, Chair, just to advise, since the last meeting, that we've been updated by NHS Tayside that they expect to fill the current voting member vacancy and confirm this at their next board meeting on the 29th of April, that Beth Hamilton, who's an NHS board member, will be appointed to that role. The proxy members from NHS Tayside will remain as Dr. Norman Pratt, but in addition we'll also have Mr. Donald McPherson, who's a board member as well. The other update to make is that, as I've already set out, Lindsay Glover is substituting for Alan Drummond today. That's because Alan couldn't make the meeting today, but he's actually due to retire from his role with NHS Tayside shortly. So the board are asked to agree that Lindsay Glover formally replace Alan Drummond with immediate effect on the IGB from today. Thank you.
Thanks for that, Scott. Lindsay, you're very welcome. Can I ask that the board endorse the proposed appointment of Lindsay to the Integration Joint Board? And is otherwise minded, please comment in the chat initially. Nothing coming through. You're very welcome, Lindsay, and thank you for that. And if I may, just at this opportunity, take this opportunity to thank Alan Drummond, the staff representative for NHS Tayside, for his contributions over 4.5 years to the Perth and Kinross Integration Joint Board. Alan was a strong advocate, is a strong advocate for staff interests in NHS Tayside, and his contributions were always very welcome. But Lindsay, you're very welcome, and we look forward to your contributions going forward. Okay, is that all you had to say at the moment, Scott? Yeah. Yeah, no, thank you for that. And without further ado, then I'll move on to item 2. If there are any declarations of interest in respect of the business to be discussed this afternoon, can members please type DI in the chat, and we shall take a note of any declarations made. I'll give it a few seconds for that to happen. Doesn't appear to be happening, so we will move on without further ado to item 3, which is the minute of the Perth and Kinross Integration Joint Board of 17th of February, which members have a draft copy of. Are there any comments or inaccuracies or omissions which members wish to flag up at this point? If so, please type comment in the chat. Again, there do not appear to be any comments, so I shall take silence as approval of the minutes. Are the minutes approved? Thank you. Okay, moving on to item 4 on the agenda. That is our regular action points update, and I'll ask Gordon Patterson, Chief Officer, to, sorry, I should learn to give a few extra seconds. And Councillor McDade, do you have a question on the minutes?
Yeah, sorry, Chair. There does seem to be a slight delay here. I just wondered why we haven't got the minutes of the 31st of March as well.
Chair, I can advise on that. Just apologies due to a combination of annual leave and other work pressures in the team. We haven't got that to produce today, but we'll make sure that that's submitted to the next meeting of the board for approval.
Okay, thank you.
Okay, thank you for that. So the minutes, we're happy that the minutes of the 17th of February are approved. Okay, so back on to item 4, action points update, and if I can ask Gordon Patterson to come in at this point, please.
Thank you, Chair. Good afternoon, members. Yeah, there are 2 items outstanding on the action points update, which members will see at item 4 on this agenda. Item number 130 relates to bringing forward the terms of reference for strategy groups at future IGB meeting. As my report indicates, we've begun to review our approach, or to advance our approach in relation to strategy groups. And in my Chief Officer's report, I'll provide more details, particularly on the reinstatement of our strategic planning group. We have today attached the terms of reference for the revised strategic planning group. However, this action point probably needs to remain outstanding because we haven't yet got to the point where we have developed a common terms of reference for each of the strategy groups. Some of the strategy groups are already operational and have been for quite some time, but I recognise that there is value in bringing together the terms of reference of each of those groups and developing a common approach so that the IGB and indeed the strategic planning group are cited on the focus of activity that they'll be taking forward. So I would propose to the IGB that we keep that as an ongoing action that I'll report back to in June, because by that time we will have advanced the actions described in my Chief Officer's report. In relation to 131, mental health and wellbeing strategy, it remains the case that we need to bring back to the IGB a financial framework that underpins Living Life Well, the Tayside mental health and wellbeing strategy. As members may well be aware, Kate Bell has finished her work with NHS Tayside. It was always time limited, and she has returned with our good wishes and thanks for the work she's done to her substantive post in NHS Lanarkshire. In order, though, to progress this action, the chief officers, the chief finance officers from the 3 health and social care partnerships have begun some discussions with colleagues in NHS Tayside on the need for such a financial framework to be developed, and in anticipation that this will be reported to a future IGB. Members will perhaps recognise that this has not been able to be afforded the priority it might otherwise have because of the budget setting process, the year-end process, and of course the significant impact of the pandemic. So this will be something that needs to be returned at a future date, and we will endeavour to progress that. IGB members may well be aware that both Dundee and Angus IGBs were also minded to seek a financial framework to underpin Living Life Well. So that work continues. I think Maureen maybe has a question.
Yeah, okay. Have you finished your report now?
Yeah. So I'm happy to take any questions, Chair. Absolutely.
Okay, thanks. Okay,
Maureen,
Maureen,
yeah.
I
I just wondered how they're going to do the financial, framework, because they still haven't decided finally on a single site for inpatients, and presumably that would affect any costings or anything like that. So I just wondered how that's going to happen.
Yeah, I mean, I think you're right to recognise that that is part of the total funding envelope that needs to be reviewed, and obviously our ambition within Health and Social Care Partnership, given our commitment to community mental health services, is to look at how we can shift the balance of care away from hospital beds to more robust community services. So it will be important that that's factored in, Maureen, absolutely. And that perhaps gives a measure of the challenge that we face in terms of developing this financial framework. However, I do see that Jane Smith had put her camera on and may well wish to supplement what I've just said, Chair.
Just to follow on from what Gordon has said, Maureen, I think that's a very good example of the level of development work that is required to develop a robust financial framework. So there is no question that there is a challenge to deliver on a financial framework, and it will be about the finance team working very, very closely with service colleagues to understand the plans and to understand, therefore, the financial implications.
Okay.
Thank you, but I still don't understand how they can start to decide on the money that's required until they actually know where the single site is going to be. And that hasn't been decided. That was left up in the air when Kate left. So I don't know what plans are to take that forward, you know, to do an option appraisal on whatever sites they're going to be looking at, you know, but I don't understand how they can actually do a financial framework on the work at the moment. So,
Do you have any further comments to add to that, Gordon, at all?
No, I think Maureen illustrates the complexity of some of this. My understanding is that some development work has been undertaken in relation to the option appraisal or the rapid review as it was described, and that there is an intention to report an update to the scrutiny panel that oversees the work of the delivery of Living Life Well. Until that report's been considered, I probably wouldn't be in a position to formally update the IJB, although in Kate Bell's absence I have reminded Mike Winter, the Associate Medical Director, that it will be very important that Perth and Kinross IJB is cited on any proposals, given that we continue within the auspices of our integration scheme to retain strategic planning and commissioning responsibilities in this regard.
Okay, thank you. Okay, thanks. So we've kind of moved into matters arising, which is item 5 on the agenda. Are there any further matters arising that members wish to raise at this point in time? I was waiting to see if any questions come in. Can I just record and welcome the arrival of Bob Benson, Vice Chair, now having joined us on the telephone, and welcome Bob, and also Stuart Hope, the staff representative for Perth and Kinross Council. Stuart, welcome. Okay, there don't appear to be any oh, we do. Again, a bit of a time delay in my end here. Matters arising, Pat.
I would like to put the reporting of clinic care governance on the agenda as part of matters arising.
Okay, so that is, I think, something that will come out of today. Obviously, the Chief Officer's report, which we're about to move on to, will cover that issue, and I think arising from that, it may well be indeed, as you say, that that this would be something that would be added going forward for future meetings, Pat. Yeah.
Thank you, Chair.
Okay, that's fine. Doesn't appear to be anything else, so thank you for that, and we shall therefore move on to the said Chief Officer's update. Now, I think, Gordon, we've had a discussion, and given the nature of your report and its structure, we think it would be in the best interest of members if you delivered your report in sections and invited questions for each section rather than waiting to the end. So if you'd like to proceed, that would be splendid. Thank you.
Thank you very much, Chair. I'm happy to do so, and I'm mindful of your request that we try to be brief and concise. So I would intend to merely provide a brief summary in relation to the various sections in my Chief Officer's report, and following each summary we can take questions on that matter as you've suggested. I think it's important though just to refer to the background to this report, as I've cited therein. The reduced prevalence of COVID means that we are now, as a health and social care partnership, beginning to be able to progress some of the plans and actions that were perhaps less of a priority while we were seeking to mitigate the impact of the pandemic on our citizens, communities, staff and services. We should caution though against complacency and not promote in any way the notion that the pandemic is over. Health and Social Care Partnership, Council and colleagues and NHS Tayside, including particularly Public Health, are actively involved in delivering the vaccine programme. We continue to promote testing. We're providing oversight and support to care homes. We're adopting new safe working practices, and we're continuing to respond to outbreaks. We're also attentive to the risk of a third wave or of new variants of COVID emerging. However, we have seen significant progress in relation to the fight against the pandemic, and we're seeing that manifest in fewer outbreaks and in reduced prevalence. So my report today reflects the actions that we're now being able to return to in the context of remobilisation and recovery in the new normal in which we're operating. My report covers 5 areas, and these are presented by way of an update to IGB members on the work that is being progressed, some of which will result in further papers coming to the IGB at a later date for formal approval. One such example is at Section 3, the Perth and Kinross Health and Social Care Partnership, Community, Mental Health and Wellbeing Strategy. This updates members on progress. It provides information on the key themes that are being considered by stakeholders who are working with us. It describes the process and it links to the Living Life Well Tayside strategy. This section of my report also advises on our intention to revisit the progress made locally in response to David Strang's Trust and Respect report and the review carried out by Healthcare Improvement Scotland. The challenge in developing our community mental health strategy will be in matching our ambition to deliver accessible, responsive and effective community services with our available resources. Of course, we need to ensure that we are delivering best value with these resources. However, we will also be looking to identify proposed future developments should additional funding become forthcoming directed towards community mental health services. Chair, I'd be happy to take at this juncture any questions on Section 3, the Perth and Kinross Community Mental Health and Wellbeing Strategy. And Evelyn Devine is also here as Head of Health. She's been overseeing some of this work and may also wish to contribute.
Thank you for that, Gordon. And just before we move on to questions on that, can I just remind those who have joined the meeting since the beginning of it that it is a pre-election period that we are in just now, and so it is vitally important, first of all, that no political comments are made. And I would ask you all to respect that. I would also ask you all to reflect on what your backgrounds might be, which may be perceived as political, and if you can perhaps switch off your cameras and or remove anything behind you that may be deemed political, that would be very much appreciated. Thank you. Okay, moving on to this Section 3, Community Mental Health and Wellbeing Strategy. Are there any questions on that for Gordon? If so, please type Q in the chat. And we have Councillor Purvis.
Thank you, Chair, and thank you for that update, Chief Officer. It's not directly related to the community mental health strategy, but is on the redesign programme itself, and I know that you alluded to that in your comments to Maureen a little earlier. It was just really to understand, I know you said that we would have to have sight of any proposals, but clearly there's a very strong link, as you talked about, between the community services and then also what inpatient beds and services that we deliver later on. I'm just slightly concerned, given some of the previous discussions that we've had at various meetings, that that is on track. and just whether you could give us an assurance about when we'll get more information. And linked to that, my understanding was we were having the redesign programme as a standing item on the IGB going forward following a previous decision. I appreciate maybe it might be due to COVID and demand pressures, but just could we have an assurance that that will come back once the agendas are back to normal, so we can continue to monitor that? Thanks.
Gordon.
Apologies, wrong button. Councillor Purvis, thank you for your question. I mean, I think it is the case that we have not been as focused as an IGB or certainly as a Health and Social Care Partnership on the redesign programme for the duration of the pandemic. I think it's also fair to say that the other complicating factor was the Minister's intervention and request that the operational responsibility for these services, for the inpatient services, be transferred back to another director in the NHS. So obviously that has led to the oversight and the progress in this regard being advanced by Kate Bell and a project team supporting Kate. It will then be important to do a couple of things, and one of them is, as you've described, is to ensure that the IGB's responsibility in this regard are recognised, and I will continue to pursue that with Dr. Winter, who at the moment is overseeing this work. The other consideration inevitably will be around how we ensure that any appointment to the Director of Mental Health, which is still the intention of NHS Tayside to pursue, continues to recognise that in this regard particularly, there is a hosting and a strategic planning oversight arrangement that is held by Perth and Kinross IGB, and includes reference to the other two IGBs, particularly given the criticality of getting that balance right between hospital beds, where they're located, and community services. My understanding, however, at the moment is that the proposed direction of travel endorses the previous decision of Perth and Kinross IGB, and I think, as Maureen has alluded to, there has been a proposal that mental health services should continue to be centralised around Carsview, and learning disability services in Murray Royal. That, though, as I understand it, was not able to secure universal support amongst the members of the group who were participating in the rapid review, and that has reached a bit of an impasse, which will be considered, as I say, by the scrutiny panel that oversees the delivery of Living Life Well. As I've committed, I will endeavour to ensure that regular reports are brought back to the IGB in Perth and Kinross in this regard, and I am sensitive to Councillor Purvis's important recognition that that is not to be so much told what's happening, but to be engaged in a discussion about whether or not that's approved.
Thanks. I'm guessing, Councillor Purvis, that your S is for supplementary.
Yes, it was, Chair. Just very briefly, I know you want to keep things on track, but just to reiterate the point, while yes, in 2018 we did make the decision to progress with the redesign programme, and then renewed that, we said we wanted to pause it, insofar as anything that had to be done could continue to be done, and the decision that we took following the David Strang's report. I just want to reiterate that the most recent report that we got from Kate Bell did include in that a commitment for this options appraisal and this rapid review. So I do want to see that. I know we've had previous discussions about it, and if that only ends up being one option, I think that given we took a decision to agree the strategy on the basis of that commitment, or certainly that was a part of that commitment, that I would then need to review that and want more information. So it's just if we could get that specific point about the redesign programme coming back, so that we can decide how that impacts on our responsibilities strategically, but also the community mental health strategy. So just to reiterate that, if that's okay. Thank you.
Okay, thank you. Maureen Summers. You're on mute still, Maureen.
I'm just getting used to this because I keep trying to touch the button instead of using the mouse, so that's why there's a delay. Yeah, there was this decision made at the expert panel that it was agreed that Carsview was not the best site, and there was a suggestion made by one of the stakeholder participation group members that they set up a subgroup to look at other possible options for the single site within Tayside. We would hope that Murray Royal would be one of them, but they also mentioned places like, the site in Angus, and also even King's Cross was mentioned, although I don't know how that would happen. But anyway, that's never actually, we've never heard any more about that, but they have to go forward, with looking at potential sites, and not just enforce this option that was the only single option. We were there to do an option appraisal and then presented with this one option. So the whole thing needs to be completely looked at, and we have to make sure that they're not progressing anyway with what they wanted to do. And I believe that there's still money getting poured into Carsview, although they were told to pause the proceedings on that. But I just feel that we, especially us in Perth and Kinross, we need to keep our finger on the ball here about everything that's happening in mental health. I had a Zoom meeting with Chris Lamont a couple of weeks ago, and we discussed, quite a few things that would be beneficial for Perth and Kinross, and we have to, as Perth and Kinross, we have to, ensure that things happen.
Yeah. Okay.
They're not happening now, so.
Okay, I didn't detect a question in there anywhere, Maureen, if I can ask.
Yes, well, the question was, we were told that they would set up a panel to look at, other possible options, and this hadn't happened. And I want to know why we haven't heard any more about it. We were told that it would be progressed to June, but David Strang is actually here just now. The stakeholder participation.
So I think Evelyn's invited to come in and give a further comment in this area. Evelyn.
Thanks, Chair. I think it's just to say, Amy, Maureen is right in terms of the fact that Kate Bell, before her departure, was very clear that if the option wasn't the option, then there would be an opportunity to review it. So Maureen is right around that, and I think there's probably been a slight hiatus between Kate's departure and where we go next. But I think we are keeping the pressure on Tayside through all sorts of working groups to ensure that we get that move forward in terms of the review of the option appraisal in its totality, Maureen, because I believe there were more options on the table that weren't reviewed. So absolutely. And between Chris and myself and Gordon, we're working hard to be party to all the conversations around mental health. So it's just an assurance that we're absolutely doing that.
Okay, thank you. Pat Kilpatrick.
I've got two questions for Gordon. The first one is less about strategy, I suppose, and more about what's coming round the corner and whether we have sufficient resources to cope with that. If you read the national press on mental health services, it talks about a tsunami of mental health need, which is beginning to emerge from this pandemic and is likely to just be the tip of the iceberg at the moment. And a lot of that need is focused around young people up to the age of 25, so adolescents, but also adults, young adults, and talks about increases in self-harm, increases in suicide, and generally increases in depression and mental distress. And my question to Gordon, this is the first question, is have we got the resources and the systems and processes set up to deal with that? And my second question, and they're related, is do we have sufficient community mental health staff to see patients quickly when they're discharged from hospital? Because if we don't, there's a great likelihood that they'll end up being readmitted. And we've got one of the highest hospital admission rates in Scotland, in Tayside. And, that's not That's not an accident. Both my questions are around resources, firstly young people, and then secondly more generally community mental health. Thank you, Chair.
Thanks. Gordon.
Thank you, Pat, for those questions. The development of our strategy will certainly need to reflect on the challenge that you've presented. It will absolutely be taking into account not what we knew when we started this process a year ago, but what we know now and what we might anticipate. It will be important that we develop responses to what you've described. It's otherwise elsewhere been described as the potential that Scottish society will experience some sort of post-traumatic stress after the pandemic. And this will mean that people who already have enduring mental health problems may well have those compounded, but that a new population of people who may well be experiencing social isolation, disconnectedness and anxiety as a result of the pandemic may well require a level of support that previously wasn't the case. We have the resources that we have, and those are our core funding. We have particular pockets of money through Action 15 and the Primary Care Improvement Fund, and we are aware of the potential for further funding being made available as a consequence of budget decisions. What we need to do is look at how we can prioritise that as effectively as possible, how we can make best use of that as efficiently as possible, and what opportunities there are for us to seek additional funding, which can only come from either the government of the day or from our statutory partners. So we would be anticipating that in the course of developing our community mental health strategy, we will find ourselves with a demographic profile and a data analysis that will far better be able to answer that question about what is the scale of the gap between that which we would like to do and that which we can afford to do. And it would therefore then be something that we would be reporting to the IGB, seeking support from the IGB members in relation to the representations that may need to be made to other places. But absolutely, that is something that we are very sensitive to, and has actually in some ways contributed to some of the delays in progressing the strategy, because it's been a bit of a movable feast, and we have been very keen to look at the impact of the pandemic, because we believe that that won't just be with us for this year. Pat, that was probably a far less brief answer than the chair would have liked, but I'm also not sure that I covered both your points. Could you remind me if there's anything outstanding there?
Well, no, only in the sense that if we don't have enough community mental health, I don't know whether we do have enough community mental health staff, or we have a shortage of them, or we can't recruit them, or they don't stay, or whatever. But, you know, increasingly the burden of care is going to be on them. And if we cannot see patients within the 7 to 10 days post-discharge, and if we can't, you know, see a reasonable percentage of them, and that might be the reality of it, then we need to try to ameliorate that in some way, because it's much more likely that they'll be readmitted in a much shorter time scale, and that's something, you know, from the patient's point of view, but also it's not efficient to discharge and readmit people who go into crisis because they're not getting adequate support. That's a worrying thing, and, you know, I think the IJB needs to understand that. Even if we can't necessarily today resolve it, we need to know it's a risk, it's a problem, and we need to look at resourcing it.
Yeah, that is really helpful, a useful reminder. Absolutely, that's something that we need to look at. And actually, in your other role, you've been cited in some data that we need to explore a bit further and bring forward some analysis of, and mitigating action if there's any way that we can improve our performance in that regard. I'll bring in Evelyn in a minute, but what I would also say is that our strategy needs not to just necessarily look at the provision of statutory services and the response, particularly to people who are coming out of hospital, although that is absolutely essential and core to our purpose. We're looking to develop a far more robust community infrastructure that extends to the third sector, that extends to resilience in communities and builds on community capacity, that prevents people from becoming patients and supports them as citizens, if you like, in terms of resilience and confidence, and connects them into other services, more informal services. But absolutely, we want to avoid hospital admission. We want to reduce people's length of stay when they have gone into hospital, and we want to support them to be discharged in a way that is sustainable. Those will remain our ambitions, and we will highlight to the IGB any assistance or gaps that we have, any assistance we need or gaps that we have that we feel you need to be cited on and that you may be able to assist us with. Evelyn, do you want to add anything to that? Or?
Thanks, Gordon. Yeah, I was just wanting to add that in respect of where we're at, this isn't all down to mental health services, Pat. I think it's really important to say that as an HSCP, you know, we're only beginning to see what's going to come out in terms of recovery for our citizens. And I think this will involve not just our mental health services, but our AHP services, our community nursing services. This is about dealing with multi-comorbidities. It's about dealing with, you know, sort of early intervention models, etc. So all the things we put in place, including our links models, you know, they're all designed to support in a way that gets to people earlier in their journey. So I think it is about mental health, but it's also about all our other services. So we're very mindful that we're seeing a bit of an increase in referral to our CMHT services, probably in relation to about 20% increase. So we're working that through at the minute in terms of what that looks like. And in respect of the community data that you've probably been party to, we're cleansing that as we speak. So we're beginning to be able to cleanse that through track care. So we'll have a much clearer picture about what that looks like, including the 7-day post-discharge. You know, as part of some of the prioritisation, we can always do better with discharge planning and getting people out of hospital more quickly. And that would absolutely be one of our priorities going forward.
Okay, thank you. Is that okay, Pat? Yep.
Yeah,
okay.
That's fine. Thank you.
Okay, just before I bring in Jackie Pepper, who I see wants to make a comment, Sandra, you had a question that you say dovetailed into Pat's questions. Has your question been answered?
Not entirely. You happy for me to go ahead? Yeah. So the service user and carer reference group has been reinstated, and we met earlier this week leading into today's meeting, and to give an opportunity for people to comment and contribute to the agenda, the IJB agenda. And there was a concern and discussion raised around the ongoing waiting times for CAM services and the knock-on impact that has, and as Pat was referring to, and Evelyn has also stated to other services, that this isn't standalone. And so the question was to ask, you know, is there flexibility within the IGB and from a budgetary perspective where there's the opportunity for anticipatory services that are needed for budgets to be increased and allocated accordingly? For example, with CAM services where we know there's long waiting lists and, you know, a backlog.
Yeah, I think it might be appropriate, Gordon, I don't know if you want to speak first, but to bring in Jackie, who I see is wishing to comment in this area as well. So, ladies first, Jackie.
Thank you very much, Chair. I think it's important probably just to recognise the additional resources that are coming into Perth and Kinross, specifically focused at children and young people's mental health, and a framework that's associated with that. That came out of the Mental Health Task Force that you might remember was chaired by Dame Denise Coya. So, and that includes support for counselling through schools. So every secondary school in Perth and Kinross will have a school counsellor supporting secondary school pupils, but also children from age 10 upwards. And so that's providing that non-stigmatised, easily accessible support for children through education services. And in addition, we will receive between £300,000 and £400,000 each year, and we think this will be recurring funding, which will support children aged 5, but will also extend in some circumstances to age 24 and up to 26 if the young person has care experience. And we've agreed a local strategy for that, which aligns to the Tayside-wide strategy, but also the Children's Services planning arrangements that we take forward in partnership with all our partners across Tayside. And much of that will be around support for third sector partners and very much locally based, easily accessible, non-stigmatised, self-referred, so families can self-refer themselves. So there is significant additional resource coming through. And already we have agreed to jointly fund the suicide prevention work, which will transcend all age groups. So I think that hopefully will answer some of your questions around additional resources for younger people and into young adults. Thanks.
Okay, thanks, Jackie. And Gordon, do you have anything further to add?
No, I would just reiterate perhaps what I've said in the chat, which maybe not everyone can see, and that's that obviously children's services aren't delegated to any of the health and social care partnerships, and CAM services continue to be overseen by the acute director and retained within NHS Tayside. But Jackie's points are well made, and she makes reference to a commitment that we have given as a partnership, and it's greatly supported, including funding by Education and Children's Services for the appointment of quite a senior officer to coordinate our suicide prevention activity, and that was formally agreed at yesterday's executive management team, and we will now be proceeding to advertise for that. That will work with all age groups. And as Jackie says, it will be part of the range of service responses that seek to mitigate the impact that poor mental health and mental illness is having on anyone of any age in Perth and Kinross.
Okay, thank you. And I think Jane Smith has something to add at this point as well.
Thank you, Chair. Just to remind members of the update I think I provided at the last meeting, that the Scottish Government's budget for 21-22 includes £120 million of additional investment into mental health recovery and renewal to cover CAMS, as we've discussed, psychological services, primary care services and wider community services. And we await further information from the Scottish Government around what that means for Perth and Kinross Health and Social Care Partnership. But we would hope very much that that additional funding, which we hope will come to us, will respond to exactly the challenge that Pat has set to us today.
Okay, thanks for that. Thanks, Jackie, Gordon and Jane for these responses. That okay with you, Sandra? Are you happy with that response?
Yes, thank you.
Thank you. Okay, so we have 3 further questions. We have Sandy Watts, we have Norman Pratt, and we have Maureen. Sandy.
Thank you, Chair. I'll be brief. It's 2 brief questions, please. The first one is relevant to what Pat was discussing, particularly around discharge. We had a third sector forum meeting yesterday and discussed this at length and recognised that one of the difficulties is around engagement between different services at the moment because of COVID, and whether there's anything that can be done to improve that, in particular for discharge, and whether there's anything we as third sector could be doing to improve that. And my second question was about the self-assessment of Dr. Strang's report. and the progress that's been made, and will there be opportunities for the third sector to engage in that assessment?
Thanks. I'll hand over to Gordon.
Thanks very much, Sandy. So I would probably be keen to hear, and it might not obviously be for within the IJB, a discussion that we might take offline around what is being perceived or experienced as the challenges around discharge, if that's particularly relating to people who have mental health problems. And equally, I would be very keen that we could hear from the third sector what they might bring and what we can support to fill any gaps in service provision or in our responsiveness. That really also needs to be located very firmly within our community mental health strategy as part of the range of responses that are available to address the challenges that we're experiencing. So I would be keen to hear a bit more about that, and maybe either through the connections that we need to build with the Third Sector Forum, or through Chris Lamont getting in touch in relation to the development of the strategy. That would be something that we would be very keen to do. In terms of Dr. Strang's response, in terms of the self-evaluation, at this juncture, what we're doing is we're looking at the various recommendations. We're doing that in the context of the integrated leadership group on a pan-Tayside basis, but what we've recognised we need to do now is, as a health and social care partnership, what is our local response and what is our evaluation of our performance in relation to some of the local issues relative to the recommendations that David Strang made. So I think it is now probably a good opportunity for us to look at engagement with advocacy organisations, with mental health organisations, carer support organisations, and the range of partners who are either involved in the Third Sector Forum or are stakeholders in the development of our community mental health strategy, to ensure that you have that opportunity. So we'll commit to do that, and I see Evelyn's put her camera back on. Hopefully that's something that she would wish to endorse and facilitate offline.
Gordon, absolutely. I think you've said everything that I would have said, so yeah, absolutely happy to take this offline. I think in relation to David Strang and the self-assessment, Sandy, he is surveying people, so he's put a survey out to over 3,000 people, is my understanding, and that survey goes confidentially into his team. So as far as I'm aware, that's the sort of approach he's taken in relation to this, in relation to the self-assessment. But as Gordon says, we're undertaking a self-assessment ourselves in terms of how we feel we've done, and we have put out some surveys to groups of third sector organisations. So we will be following that up.
Okay, Sandy.
Yes, thank you very much, Chair. We appreciate how busy everybody is, but we'd welcome if we can meet up and discuss those issues further. Thank you very much.
That's very helpful. Thanks. Okay, I'll move on to Norman Pratt.
Yeah, thanks very much. So with so much pressure on existing services, how do we migrate towards community prevention? Particularly thinking about youth substance abuse and the Iceland model that perhaps people haven't seen, that has shown, at least on the surface, so some pretty spectacular effect. You know, we've got to try and get ahead of the curve. I'm sure you agree. And also, I appreciate that this isn't an issue for P&K, you know, or probably Tayside. I realise it may require it's government leadership on this. Thank you.
Thanks. Gordon.
Thanks, Norman. I mean, I do appreciate your keen interest in this, and actually it's been beneficial that you've shared with some colleagues some articles on other models and approaches that we could usefully learn from. I think it is about taking a steer from the national government, looking at what can be done on a pan-Tayside basis, both in terms of the councils and the NHS and the health and social care partnerships. But that doesn't preclude us from looking at what we can do locally that is going to much more effectively support people at an early stage in order that the more acute and the more intensive and expensive interventions that are necessary, that can be necessary, are prevented or delayed. We have a strategic ambition to advance early intervention and prevention, and we would be looking at how we can give effect to that through the work of the Alcohol and Drug Partnership, through the collective response to the Drugs Death Commission, and through the development locally of a substance misuse strategy that enables us to, as you say, get ahead of the curve. I don't have a great level of detail in terms of the approaches that we are currently advancing in that regard, but certainly would wish to assure you that we're keen to look at new and innovative approaches that take us to a position where we're keeping people well rather than responding to ill health. And that extends to, you know, low-level mental health support, but it also extends to the delivery of services by our social prescribers across Perth and Kinross. And we're currently reviewing and seeking to advance their work in a way that is more consistent, more robust, and more evidence-based. And that will extend to a range of people with a range of needs, including people who might otherwise find themselves engaged in substance misuse. So we will be looking at a range of approaches. I need to acknowledge that what I've said is not particularly specific, may not answer your question, but I can provide that assurance that we will be pursuing all avenues to try to support preventative activities.
Great, thanks very much.
Thanks, Norman, for your question. Thanks for that answer. The final question I have at the moment is from Maureen. You have a further question?
Yes, just after what you just said there, Gordon, I just wondered if there is anything being pursued to replace the Scotland All Strong facility that was suggested, which would have been a great facility to prevent crisis in the community and to promote ongoing well-being. But that seems to have fallen through, not just because of the funding, but apparently the premises have fallen now as well. And I just wondered how urgently we're actually pursuing a replacement for that, because that was something that would have really worked in the community. And when I heard about it, I did speak to different service user organisations saying that this was coming, and it was, greatly anticipated. And now, there doesn't seem to. I just wondered, does anybody know at all, Evelyn or Chris, do they know what's been done to replace that thing that seems to have fallen through? And the second thing was as regards what Pat was saying about the community mental health teams. I spoke to a friend I have in one of the community mental health teams in Perth and Kinross, and she is totally stretched in that. They've got unrealistic caseloads, and I just wondered, well, I actually asked Chris when I met with him on Zoom a couple of weeks ago if you could provide figures for the mental health community mental health teams, say 2 years ago, and what they are now, and what the proposals are for replacing them. But I've never had any response to that. So.
Okay, so I mean, I don't think we've got anything to add to your question around Scotland All Strong to the answers that we perhaps gave at the development session, but I'm conscious the development session was a private session, so I'm happy just to reiterate that my understanding is that Scotland All Strong were pursuing an option themselves and hadn't sought support from the Health and Social Care Partnership, although we had recognised that what they were doing would be a useful contribution to the range of services available to people who may be having problems with their emotional health and well-being. We have, though, sought to give them advice on where sources of funding may well be able to be identified. The overarching point that I would make though, Maureen, would probably be around what we need to do is to ensure that the allocation of funding or the support that we're able to offer, albeit limited by our available budget, is designed to underpin the new community mental health strategy, and it will have the priorities for moving forward that the Health and Social Care Partnership will be commending to the IJB for approval. And that might include further work in the area that Scotland All Strong are working in. We remain available to support them and to engage with them, and I think that is happening on an ongoing basis, but I don't have any more detail at this juncture. I don't have the operational information that you've asked for, and I appreciate that you're very interested in this, but it's maybe not necessarily something for the IGB's strategic role. But in terms of the caseloads of the community mental health team, I think people will be stretched, I think people will be busy, and I think our staff are also, as we are very aware of, experiencing the physical and psychological toll of having worked through a pandemic. So we've got a range of measures that we're trying to introduce in order to promote staff well-being, and in order to ensure that staff have the resilience that we need from them. But there will also be practical measures about how we manage caseloads. Now, the way in which we do so is we either increase capacity or we ration supply through eligibility criteria. We need to find a middle ground that enables people to access services, and this absolutely does refer back to the question that Pat Kilpatrick was asking earlier. The other thing I would say though is that we've recently carried out a pulse survey across NHS Tayside of all the mental health teams, and we looked yesterday at our executive management team at the responses from Perth and Kinross. Those responses will be considered at our local partnership forum next week. Those responses have already been discussed with the teams in question, and those responses are really very positive in terms of how staff feel, how they feel supported and how they feel valued, and how they feel that the organisation, Perth and Kinross Partnership, is listening to them. They have identified some areas where we might improve, and we are committed to taking those forward. And as I say, we'll be reporting to the local partnership forum in order that that can both be supported by and scrutinised by our colleagues on the staff side to ensure that we are developing adequate supports and responding effectively to some of the pressures that our colleagues are under. So I hope that's a useful answer, and we can maybe take some of the discussion in relation to specific providers into the community mental health stakeholder group.
Okay, thank you, Gordon, and thanks for your questions again, Maureen. I'm conscious that my Vice Chair Bob Benson is on the phones, and Bob, you may have a question on this or you may not. If you do, can I just remind you that you would need to press *6 on your phone to unmute it and come in. You're welcome to come in now if you wish. Nope, nothing coming in. Okay. So just finally, therefore, on this section of first section of Gordon's report, and I'm conscious that we've spent a lot of time on this, and obviously the community mental health strategy will come back to June's IJB for full debate and consideration. And I know that Jackie Pepper has helpfully put a comment in the chat to the effect that it might be useful for the IJB to have sight of the children and young people's mental health and wellbeing strategy, and I think that indeed would be helpful, Jackie, because obviously we do need to have an understanding of the bigger picture in order for us to take decisions in relation to those areas that we do have responsibility for. So that I think that would be helpful if that could be organised. But if there are no further questions on that section of Gordon's report, Gordon, do you want to move on to the next bit on adult support and protection self-evaluation?
Yes, thank you, Chair. So section 4 of my report provides IJB members with an update on the self-evaluation activity that we're progressing with partners in respect of our local multi-agency approach to adult support and protection. I've got described in my report a range of actions that were initiated in anticipation of an inspection of our services by the Care Inspectorate, Healthcare Improvement Scotland and Her Majesty's Inspectorate of Constabulary. We understand that an inspection is not now imminent, however we recognise that the actions that we've been advancing remain valid, necessary and important in order to assure ourselves to improve our services and to assure the Adult Protection Committee and the Public Protection Chief Officers Group. So I felt it was important that the IJB were cited on this work that has managed to keep going throughout the pandemic, albeit not with the focus that we would otherwise have given it, but to be aware of the intention that we develop an improvement plan and ensure that our work within social work, with health, with the police and the third sector is developing effective responses in relation to the statutory responsibilities that fall to us under the 2007 Adult Support and Protection Act. I'm happy to take any questions and recognise that Jackie Pepper may also be keen to contribute, and Kenny Ogilvie, who's been part of the leadership group that's been working on this. Thank you, Chair.
Thanks, Gordon. And inviting questions now, and if you want to put a queue in the chat if you have a question, but if I would just pass a brief comment myself, how welcome it is to read of the ongoing efforts, irrespective of any upcoming inspection. The ongoing efforts to develop our work in this area is much appreciated. Are there any questions? No, don't think I'm seeing any questions on this particular item, so thanks for that for now anyway, Gordon. And if we want to move on to the next section, thanks. Oh, a comment from Jackie.
Thank you. It was really just to echo what Gordon was saying and saying I think it's really important that although this work's been done, that it's not seen as something that will then sit on the shelf, but that actually it's become a dynamic process of continued self-evaluation. And I think that's so at any point if we were to be inspected, we're in a state of readiness, and I think that's a really healthy place to be. So yeah. And just to commend everybody who's been involved in that work. Thanks.
No, thank you. Okay, and we appear to have a question from Maureen. Maureen?
Yeah, I noticed that on the list, the partnership group comprised of, and it's got Diane Fraser's name on there. Is there a replacement for Diane there?
Good spot, Maureen. Yeah, absolutely. We'll poach her from North Lanarkshire, that's what we'll do. Obviously, clearly, she will be replaced. I don't know if Jackie or Gordon can come in there.
Yeah, so...
Saw the delay and I was going to come in, but I'll leave it to you, Gordon.
Yeah, it would probably be, I think, South Lanarkshire we might poach Diane from, but I'm not sure, I can't remember. Absolutely, well spotted, Maureen. An earlier iteration of my report said that would now be Kenny Ogilvie who's leading on this, and who I mentioned at the start of my introduction. We have both Kenny Ogilvie and Zoe Robertson who are covering parts of Diane's portfolio on an interim basis. Kenny is providing professional leadership alongside supporting Jackie as Deputy Chief Social Work Officer and is overseeing the professional social work teams. Zoe's role is around contracts and commissioning and some service development around care at home. So we have those arrangements in place for 6 months and we also have an ambition within that 6 months to be progressing our earlier intended restructure of the Health and Social Care Partnership to move to a much more integrated way of working. So apologies for not correcting that in my report, and very well spotted, Maureen, thank you.
Okay, thanks. You want to move on now, Gordon, to the interim workforce plan?
Certainly, Chair, thank you. Section 5 of my report outlines the actions being progressed in response to Scottish Government guidance that requires each Health and Social Care Partnership and Health Board to develop an interim workforce plan. It had previously been the case that a 3-year plan was due to be produced by the end of March. However, earlier in the pandemic, it was recognised that that wouldn't be a priority. So what we've now been asked to do is a 1-year plan that aligns to our remobilisation plan and looks at the workforce pressures and demands that will be presented in the course of the financial year that we're now in. That will become a prelude for a 3-year workforce plan that the Scottish Government have asked us to develop by the end of March next year. Our draft plan has now been considered by our workforce planning group, including representatives from the trade unions and HR. Further comments been received. And whilst this needs to be submitted next week, we have recognised that the workforce plan needs to further develop and recognise the physical and emotional toll the pandemic's had on our staff, and to more robustly expand on the actions that we will take to support staff to have opportunities for recuperation and recovery, and to provide wellbeing support and to help rebuild resilience. I'm happy to take any questions on section 5 on the interim workforce plan, and may also bring in Jane Smith, who has been very much overseeing and being a driving force behind some of this work. So thank you very much, Chair.
Okay, thanks, Gordon. Are there any questions for Gordon or Jane? If so, please put a Q in the chat. Ronnie.
Thanks, Eric. It's just a brief question, Gordon, on 5.3, where you talk about the limited resource capacity to develop plans and programmes and strategies. Do you feel you'll be in a place to achieve what you want to in this area this year?
Yes, Ronnie, I'm grateful for you highlighting that point and for your continuing and welcome concern about the level of capacity within the partnership. It is a matter of concern. I think it's interesting that when the Scottish Government ask for you to nominate your workforce lead, you look around to say, well, we don't have a workforce lead. Who can do it on top of their day job? So it is a challenge, and I think we've been able to do it because of the reduced pressure in relation to the pandemic. But what we've also done is engaged with colleagues in our statutory partners who are also embarking upon this process. And we have, Jane will probably want to speak to this, the ambition potentially for an inward secondment to provide some HR support into the partnership in order to help bridge that gap. So, Jane, I'm sorry if I've stole your thunder, but can you please come in?
No, thank you, Gordon, and thank you, Ronnie. I'm really pleased that you have asked the question, because at our executive management team yesterday, we have discussed the risk that is real in terms of the partnership, in terms of the level of support that is available. You know, the 1-year plan we will do, but we've then the bigger task of a 3-year plan that really sets out some of the major you know, responses that are required to our workforce risk. It's a big job. So I'm in very early discussions with HR colleagues in both Perth and Kinross Council and NHST side about a test of change around investing in workforce planning support, so that we can, really drive this with the level of expertise that is required.
That's great. That sounds like you're both really on top of that. So thanks for the answer.
Thank you. There are no further questions on the chat. I noticed, Bob, you have rejoined the call. I didn't know that you had dropped off, so apologies for that. I was asking you a few minutes ago if you had any questions on Gordon's report. We've yet to get to strategic planning and clinical care and professional governance. But if you had any questions that that you wanted to ask or comments to make on the previous sections of his report, then feel free to chip in now while we have you.
Is that okay? Can you hear me, Chair?
Can hear you perfectly.
Oh,
yep.
Good, that's fine. Actually, I think the questions that have been raised so far are the ones that I would have asked. I think Ronnie's question that he's just asked on workforce planning is actually probably the single biggest issue, because we do know that we cannot spend certain monies because we do not have the resource capacity to actually spend these funds, which seems a ridiculous situation given the pressures that we know we are under and are likely to be under. So that is a major issue for me, and I may have missed a bit about timescale of when we're going to get the workforce plan. So could perhaps Chief Officer just give me an update on that, please? Thank you, Chair.
Yes, thanks, Bob. Happy to do so. I mean, the interim workforce plan, which covers the 1 year period, has to be submitted as a draft to the Scottish Government by the 31st at the end of this month. And we then anticipate there'll be a period where they'll give feedback and there'll be a period of refinement. It was our intention to bring it for approval to the June IJB, but as we'll discuss later, we do have a concern about the numbers of papers that we are currently proposing to bring to the June IJB. So that would be the time frame, and it certainly needs to be concluded in the next week as a final draft.
Thank you very much, and perhaps you might be able to update us during the May development session, if that would be helpful. Thank you.
Yeah, no, thanks for that, and the point you make is absolutely right, Bob. I mean, when we come on to look at the financial reports, as we will do later this afternoon, clearly a number of underspends, a significant proportion of underspend is in relation to vacancies, and that seems to pervade a number of areas of the service, including our hosted services, and no doubt that Jane will comment on that during her presentation. But there don't appear to be any further questions on that section at the moment, Gordon, so if you want to move on to strategic planning.
Thank you, Chair. So section 6 of my report talks about strategic planning and the strategic planning group. This advises on the work that we are recommencing to reinstate and refresh the IJB's strategic planning group. It will have a new terms of reference, which we've included as an appendix, and a membership that reflects the statutory guidance in this respect. I was going to share the membership with the IJB, but I realised that we haven't approached everyone on that list to ask them if they would like to be members, so I haven't put that into the public domain just at the moment. However, the membership reflects the requirements, as I say, in the guidance, but also includes extensive contributions from public partners, from the third sector, from the independent sector, and from various voluntary organisations. The strategic planning group's focus will be to monitor progress in respect of the delivery of the IJB's strategic commissioning plan, and will oversee progress for this year in the context of the remobilisation plan. Strategic Planning Group will also receive updates on the work of the various strategy groups, and I've provided an appendix with a list of those groups and tried to show how they would report to the SPG, the Strategic Planning Group. For it, we'll also be providing a sort of critical friend to strategy group leads. It will review draft strategies and it will report to the IGB on its work. Hopefully members have had the opportunity to read my report, and I won't probably say any more than that, Chair. I'm happy to take any questions, but also, as always, I've got someone who can support me with the more difficult ones, and on this occasion it would be Zoe Robertson, although I would not wish to ask Zoe to take on too much here. I'm happy to field any questions in the first instance.
Well, thanks. If anybody has a question, if they can put it in the chat. In the meantime, I have one myself, if I may, Gordon, which is references made in the appendix to the importance of gaining the views from each locality, and clearly that's an issue that the Cabinet Secretary has mentioned to the IJB chairs and vice chairs in relation to needing to ensure that going forward services are reflective of the respective localities, and we have clearly both urban and rural and remote rural locations in Perth and Kinross, and I just wanted to try and understand whether these groups to which you have given detail will be sufficiently large, or at least the ones involving at least service users, unpaid carers and staff, will be sufficiently large to reflect the 3 localities within Perth and Kinross.
Thank you, Chair. This is an area that Zoe is very passionate about, and I shall bring her in a minute. I think the question's really important and really appropriate, because what we're continually wrestling with is the balance between functional and geographical, whether that's in thinking about a new structure moving forward and thinking about how managers are allocated their portfolios. And whilst we're developing a strategy for carers, or a strategy for people with a learning disability, or a strategy for people with dementia, it will be a Perth and Kinross strategy, but it will need to give due regard to local conditions in terms of the availability and accessibility of services, particularly, given your point about people who are experiencing access deprivation because they're in more rural and remote areas. I'm very keen that we look at the potential to develop our current community engagement team and think about community development as a concept again that we would wish to embrace and invest in. If I could refer back though to Ronnie Erskine's question, so whilst we have a challenge around capacity to do workforce planning with all these strategy groups, we will need to bring forward proposals around, have we got enough policy and planning people who are working alongside operational managers to give effect to the consultation, engagement, planning and delivery of these strategies. And as I say that, I am reminded that the joint inspection of the partnership of 2 years ago did report that we had in some respects not put in place adequate arrangements. So as we bring forward proposals for a new structure, which we would be looking for the IGB to challenge us on, to question and ultimately to support, there may be a need for that infrastructure to ensure that some of those challenges that you're putting to us today are better able to be addressed. And it isn't just an add-on to someone's job, that we've got people whose day job it is to deliver on policy, planning, communications, resilience, workforce planning, support to committees, support to IGB members. So these are important considerations for us moving forward. I've described that more in the generalities, but maybe Zoe would wish to say a bit more about a community focus and a locality focus in our work.
Thanks. Zoe?
Hi, yes. Yeah, I think it's particularly important to think about the localities and the bespoke nature of the localities and the difference between the rural and the urban areas. And I think that would be driven through our strategies, particularly. I suppose Care at Home is a very good example of that, but it's not singular in that the differences of a Perth City Care at Home provision and an extreme rural Care at Home provision are entirely different, and therefore our strategic modality or service delivery needs to be entirely different, and that's what we're doing through programmes of work, for example, the Care at Home review, and that work will come through the strategic planning group, and that will detail, for example, what we are doing to look at those issues that are particular to rurality and access deprivation, and that would be applicable across all of the strategy groups, because I suppose that Perth-centric approach is something that we need to address as we're moving forwards. And I'm particularly keen to make sure that informal and formal approaches to how we deliver services, whether it be before anybody even touches a statutory service or not, are considered within the work that we do, and that our strategies are absolutely cognizant of that and really fully thought through in terms of each stage of somebody's journey through a service, whether it be statutory or non-statutory.
Yeah, no, thank you for that. Thank you for these answers. Much appreciated. Councillor Purvis.
Thank you, Chair, and thank you for that update and the answer to that question, which was interesting. I think it's really important that we try and get as much input as possible from the localities and from all different sectors. It's a question I have asked before. I'm going to ask it again because it wasn't clarified in the report, but it's about the involvement of voting IGB members in the strategic planning group, or even in a observer capacity. It's clearly a body that's responsible for helping develop the strategic plan and also reviewing it, which is, one of the key functions of the IGB. And it seems to have good representation from what you've listed. I know it's not the exact list, but from in the appendix. So I'm just wondering, is that something that could be considered even in an observer capacity, that 1-2 IGB members could sit so we can actually hear things directly before making those decisions, rather than things coming through a chain, if that makes sense? Thank you.
Yeah. Thanks, Callum. Gordon?
Yeah, absolutely. I mean, I think, the partnership's accountable to the IGB, and the IGB is setting the strategic direction and will have a very strong commitment to ensuring that we are addressing a range of issues that we've discussed today and very many more. So I think we would actively welcome that, and probably should be reflecting on how that can be given effect to, and what the arrangements might be, Councillor Purvis. We're bringing forward proposals around the revised terms of reference and membership. We will run with that and see how it goes, and reserve the right to refine and develop it, and potentially also look further in relation to the question that you've asked to see what might be possible in future.
Thank you.
Thank you. And the final question from Maureen.
Sorry, I was just unmuted there. Yeah, I'm just looking at the Charter Appendix 1, and it's got the strategic planning group consists of the EMT, the Executive Management Team, and relevant others. And then there's 9 strategy groups sit under that. What are the relevant others, and how do you decide who the relevant others are?
Gordon, are you able to answer that one?
Yeah, sorry, I was talking away to myself there. I've put my camera and mic on now, so I shall seek to answer your question. I mean, in terms of membership of the strategic planning group, we've got at 6.1 Appendix 2, Maureen, details of what is prescribed in the associated regulations. And that's about people who use health and care services, unpaid carers, commercial and non-commercial providers of healthcare, etc., etc. So in terms of the contribution that stakeholders will make to the strategic planning group, we're looking to ensure that includes people who who are able to be representative of a range of groups and interests, be that carers or service users, representatives from the third sector, particularly people who are involved in service provision and or advocacy, as well as the independent sector. And we're also looking at ensuring that we've got adequate coverage in relation to the wider membership expectations around representatives from the Health and Social Care Partnership. So hopefully we'll be in a position to issue the invitations soon, and at that point it will become public in relation to who we've identified and who we've been working with to become members of the new strategic planning group, and that will now need to reflect, and appropriately so, Councillor Purvis's suggestion that there should be opportunities also for members of the IGB to participate or to observe and be in attendance. So hopefully that answers your question. In terms of the detailed membership of each of the strategy groups, I think that's for another day. Those groups, though, will be representative of stakeholders, people with lived experience, people from the third and independent sector, service users and carers, and professionals, particularly with a special interest in those areas. So I would just wish to provide that sort of general assurance that we're trying to be as inclusive as possible.
Okay, thank you for that. Don't appear to be any further questions, so we'll move on to the final section of your report on clinical care and professional governance, Gordon, and then after we've considered this element, I propose to take a short comfort break. Thanks.
Thanks, Chair. So section 7 of my report in relation to clinical and professional care governance outlines how the Health and Social Care Partnership, working in partnership with the Getting It Right for Everyone group, is looking to enhance our approach to clinical and care governance. The report reflects on the provisions of the integration scheme, on the reporting lines to our statutory partners. There is recognition within the report that in relation to clinical and care governance issues pertaining to health services, that ultimately the responsibility sits with the medical and the nurse director, and in relation to social work and social care services with the chief social work officer, both of whom report to their respective boards or committees. This also then seeks to clarify the role of the IGB in relation to what the integration scheme demands, that the IGB should be assured that the Health and Social Care Partnership have in place measures, arrangements and approaches to support feedback, development, improvement. My report then provides a bit more detail in relation to the work of our Clinical and Professional Governance Forum, and that's co-chaired by Hamish Dougal, the Associate Medical Director, and Jackie Pepper, the Chief Social Work Officer, both of whom are in attendance today and will be available to answer any more detailed questions. However, I've identified for the benefit of the IGB the level of assurance that the forum seeks from operational services through the exception reports, through the annual reports, through site visits, through scrutiny and data analysis. And I have in addition provided IGB members with details at section 7.712 of a range of other arrangements and measures that are in place that assure our medical director, our chief social work officer, our professional leads in nursing and AHP on the arrangements that are in place around clinical and care governance. And you'll see there's an extensive array of groups that either work alongside or feed into the Clinical and Professional Governance Forum. Section 7.8 explains why I've included that. It seeks to provide assurance to the IGB on the extensive measures that the partnership has in place. However, I did introduce this section of my report by recognising that on the basis of our review, which we began to undertake some time ago, but have continued to look at in the context of a review of the integration scheme. There is more that we need to do to ensure that we've got a very cohesive and robust approach within the Health and Social Care Partnership. And the report in that section finishes by suggesting that this should provide members of the IJB with some degree of assurance and an opportunity to identify whether there are any further developments that need to be put in place that would enable them to be further assured that we have in place robust measures within the Health and Social Care Partnership. And I'm happy to take any questions in that regard, Chair. And as mentioned, colleagues who are professional leads or co-chairs of the forum may also wish to participate and contribute to some of the answers. Thank you very much.
Okay, thank you, Gordon. And if I can ask anyone who has a question to put Q in the chat, as Pat Kilpatrick has done. Pat.
Thank you, Gordon, and thank you for explaining all of that in detail. And I think I think the framework and the process is very robust as far as it goes. I think what we're missing here is that the IJB itself does not get, at the moment, does not get any detailed reports or even high-level reports on the governance for health and social care, which means that we are not really discharging our accountabilities as board members, because we don't get information. Therefore, we have no real sense of to what extent are we fulfilling the requirements in terms of care governance. And I think that is a big gap in your structure and process. I know you report through to the Clinical Governance Committee, and I know you have a lot of very robust arrangements in place locally and at locality level, and I think that's all really good, and I'm assured by that. But I, as a board member, don't get any information in this forum about where we stand on care governance in a number of the areas that we report on. I mean, we are reporting on it, but just not to the IJB. And it's really maybe an issue for discussion as to what the IJB needs or what it would want to see, and to feel that it's discharging its accountabilities and responsibilities. I think it's an important issue. I think care governance is one of the reasons why we're here. And I think it needs to be considered and thought through. And I'm not putting any words in MD's mouth. I'm not saying this is what needs to be reported on. I'm just saying we need to have some form of reporting. Thanks, Chair.
Gordon, your response?
I think my response would probably be, to refer back to the integration scheme, and that perhaps for me, and I think this is complex territory. It's difficult because people have different roles and different responsibilities in different fora. The integration scheme seems to me to suggest that it's not the preserve of the IJB to involve itself in detailed operational oversight of clinical governance matters, but instead needs to recognise its responsibility as a strategic planning and commissioning board, and needs to be assured by myself, by the Chief Social Work Officer and by the Medical Director that arrangements are in place for us to report to our statutory partners who have that responsibility, who employ the staff, and where the responsibility ultimately falls. So I think it maybe does warrant a further discussion, absolutely framed around what the IJB needs, but maybe that discussion needs also to be about what's the role and function of the IJB relative to statutory partners. I think, though, I would further struggle with some of the complexities of this by saying that doesn't preclude us from reporting as we do on performance to the Audit and Performance Committee. And sometimes it is quite difficult to see any distinction between good, robust performance information and some of the clinical and care governance information. And that's maybe right. Maybe they need to be more closely aligned. But I think the integration scheme is framed in a way that seeks to ensure that IGB is able to fulfil its strategic planning and commissioning role, and to be assured that there are measures, arrangements and processes in place without necessarily delving deeply into the operational detail that persists there. So there is something about the current arrangements that is not quite falling into place, and maybe one of the ways of doing that would be around regular reports to the IGB on the level of assurance that has been sought and provided by the Scrutiny Committee of the Council or the Care Governance Committee of the NHS Board, as well as the work that the Clinical and Professional Governance Forum's undertaking. Because the interesting thing for me, and this is an important distinction, is the Clinical, Professional and Governance Forum isn't charged with the responsibility for improving operational delivery against targets and performance. It's charged with the responsibility for ensuring that operational managers are doing so and that they account to the forum. So, you know, that's another example of how nuanced some of this is and some of the challenges that we're trying to deal with here. And, you know, there's different ways of doing this, potentially a further development session, potentially looking at what the IGB would like the next integration scheme to do, or potentially us revisiting some of the work that was done before Christmas around the governance paper that some IGB members were involved in pulling together. But I see Jackie's put her camera on, which is maybe an indication that she wants to come in. I hope so, because I've now put her under pressure to say something. Jackie, over to you.
Actually, Jackie, just before you do, sorry, I wonder if I could impose upon our technical support. I have an issue where this Surface Pro has just come up saying your computer is about to restart in 13 minutes time, so I'm going to get cut off in 13 minutes time, and I am unable to delay that. I don't know if anybody can help me with that at all. Perhaps they can, but anyway, in the meantime, if I can go back on to Jackie.
Thanks, Chair. I hope not to take 13 minutes. But I think Pat's question has I suppose reinvigorated a concern that I have, and I think it's something that we need to revisit in relation to the terms of reference for the Care and Professional Governance Forum, and that is that in chairing that and then giving assurance to the Perth and Kinross Integration Joint Board, I'm actually marking my own homework, and that gives me a bit of concern. So I think there's an issue there that we probably need to address as well. And similarly, I'm sure that Hamish will have the same concerns from his perspective. But I do wonder if that's something we need to revisit in terms of our roles and responsibilities.
Well, the other added complication there is that the IGB are provided with medical advice and medical advice. They're provided with the advice of a clinician, a medical clinician, through Dr. Robertson and a professional lead in nursing through Sarah Dickey. So there is that bit about what level of assurance they are provided with by the partnership and what they can then in turn provide the IGB, given their particular professional experience and oversight and responsibility. So yeah, it's a complex area, certainly.
Thanks. Pat, you have a supplementary?
Yeah, I hear what you say, and and I'm reassured by the fact that you have robust processes in place. I think, as Jackie says, it's a bit like marking your own homework. I think the other thing is, and I feel very uncomfortable about this, is if there's something that is wrong, right? For example, and this is hypothetical, if you had a large number of serious adverse events, right? The board, IGB board, would not know would not know, because what we are really saying today is we're happy that you've got a process in place and you guys know what's happening. We don't need to know. All we need to know is there's a process in place. Well, I for one, as a board member, feel that's not right. I feel I still need to know. And the reason that I need to know is I need to ask the relevant questions, and we as a board need to make sure that you've got the proper support, the proper resources and the proper focus on all of this, so that should anything start to go horribly wrong, nobody comes back and says, well, you didn't ask the question, you didn't know how much resources they had, you didn't know if they had sufficient to tackle the problem, you didn't know about it, you didn't ask the questions, you didn't probe it, therefore it's all gone horribly wrong, and what do you as a board even know about it? Nothing. And that is not a good position to be in as an IJB board member, and I feel quite strongly about that. I would like it to be minuted. I do not feel, I'm not happy with the current situation, and I think it needs to be looked at. I'm not saying you need to report lots of operational detail about hand washing rates at Blairgowrie Cottage Hospital or anything like that, but if there are important things or things that need to be reviewed and discussed, that needs to be done openly, and I think it needs to be part of what's shared with the IJB board. Thank you, Chair, for your time.
Okay, so I mean, Chair, I would just highlight that reflects a particular understanding on the role of this board relative to other boards. The IJB's responsibilities, particularly around strategic planning and commissioning, and it's partner bodies who should be applying scrutiny to clinical and care governance matters where they pertain to operational services. So it's really the Care Governance Committee of NHS Tayside who should be scrutinising that level of detail, and maybe similarly the Scrutiny Committee of Perth and Kinross Council, and indeed in some ways they could be charged with the responsibility for providing assurance to the IJB in that regard because of the IJB's strategic planning and commissioning responsibilities. However, I think there's further questions from colleagues, but I recognise Pat's comment, and absolutely it should be noted.
Yeah, thank you. Now I continue to have difficulty because I can only see, or I can't see part of the chat, but I do see Councillor Purvis has a question, so let's go with that.
Thank you, Chair. It's really morphed into a comment now, if that's okay. I consider there don't seem to be any further questions, but it's just following on from what Mrs. Kilpatrick said, and I'm completely in agreement with her. The board did a number of years ago identify that there was a gap in the assurance it was receiving, or in this case was not receiving, over clinical care and professional governance, and there remains an extant decision from 2018 to establish a clinical care and professional governance committee which would oversee this. Now, you know, I understand that not everyone was supportive of that decision, and would have perhaps preferred different ways of providing that assurance. And I think that in subsequent discussions that I and others did say that we were willing to look at alternatives to that, such as having information being brought to the IJB or indeed to the Audit and Performance Committee. But I think that the point that Ms. Patrick raises is the key one, that there is no reporting mechanism at the moment for clinical care and professional governance. And I think the problem that we have is essentially, and while it's very welcome and useful, the information that the Chief Officer has provided in his report, it's just a process, it's a chain of assurance that, you know, there's lots of different bodies and reports that go from one to the other to say that everything is fine. And while I'm not saying there's anything wrong with that process, and I'm sure it is a very robust process, there's no objective evidence provided to me and to others as a board member to evaluate whether that process is in fact working. And I think that's the deficiency, that we need to see whether it's examples of exception reporting and how, when those exceptions have been presented, they have been resolved. It's not about, I completely agree, it's not for us, it's for the partners to operationally decide, determine and review how that how we get that assurance. But we, given that our services and therefore our strategic objectives rely on good clinical care and professional governance, we need to have that information, or at least some level of information, so that we can be assured that our strategic objectives are not being hindered by a deficiency in that regard. You know, sometimes, if I'm going to be perfectly blunt, we find out more about these things in the press than we do through formal reporting mechanisms, if there's been a serious incident or a death or something like that. And I think that we need to get better at that, and we need to put that in place. So I would really ask, and I don't know how the chair wants to progress that, but there needs to be, whether it's push again to get the committee up and running, or for the next IJB we have some kind of report where that information can start to be provided to us. I'm not precious about the mechanism, but there needs to be one. Thanks.
Okay, these comments are noted, and it's clear that there are strong opinions being expressed here. We need to take this away and come back at the most appropriate time with further discussion on this. I'm acutely aware that I'm going to disappear from your screens. That might not be a bad thing, but I'm going to disappear from your screens in 4 minutes' time, and we'd look to restart. Either Bob, if you're able to take the chair.
Yes, I can, Chair. And once you finish saying what you're going to say, I might just say that I think we need to really take this matter quite seriously, to know what our responsibilities are. It would also be really important to know how are other IJBs and TASI dealing with this same issue, because we cannot be unique with this issue, and how is that best handled? And if the current arrangements are how it's being done, then that might cover us in terms of accountability. But at the same time, as I think Callum has said, you know, often we're reading about these things in the media, which is actually quite difficult for us to pick up. And I wholly agree with what Mrs. Kilpatrick has been saying. It strikes me as that there's a matter of concern here that really needs further exploration of what can be reported through the mechanisms that we potentially have under our integration scheme and through our standing orders.
Yeah, and sorry to jump in again, Bob, but I'm just conscious I'm something else I just need to say before I sign out and sign back in again. What is important here is that we all individually as members are fully cognizant of the role of board members within in terms of the integration scheme. Clearly there are different opinions as to what that role is. So we need to highlight the terms of the integration scheme, and I think that is something that we ought to do at the next session, the development session, which is in May, and depending on what is agreed and decided at that development session, proceed accordingly at future meetings. That would be my view, because I'm acutely conscious of time, and it's 3 o'clock already, and we're early on the agenda for today. I'm not wanting to suppress this, but we do need to have this discussion and nail this issue once and for all, which I'm more than happy to facilitate at a future development session, and bringing it back to the IJB in public in due course as appropriate. Okay, so the next question I'm aware of is Ronnie Erskine, and Ronnie, if you want to go ahead with your question, I shall be disappearing in 1 minute's time, and I'll sign back in as soon as I can. Bob, you have the chair.
Thank you very much, Chair. Ronnie?
Thanks, Eric and Bob, and likewise I think my question might now be a comment, because Eric has just made the very suggestion that I was going to ask. Gordon and the chair to consider, which is for us to review this in development session next time round, with a view to bringing something back in June. Just a couple of points. One is, I think, around the balance and the subtleties of the governance here. You know, I think it's really important, as we've said, to understand the role, but also to avoid duplication or confusion in terms of who has responsibility for particular elements of this of care governance. But there are other ways round providing information, which could be provided, you know, members could be provided with information either as part of papers or out with meetings, rather than seeing things for assurance or debate. So I think there are quite a few options there. I think that the gist of what we're feeling perhaps is that there could be a reputational risk here, and we need to cover or address that in some way through appropriately providing the right information and forum for debate. That was me, Eric. I'm glad to see you're still there.
Okay, thank you. Are there any other questions on this? Gordon, can you view the meeting for me to tell me if there's anyone else? Because I would like to for a break now, please, if possible.
Well, we have a comment from Sarah Dickey, and then we have a question from Maureen Summers.
Thank you, Maureen.
It was just to ask you, oh, he's gone. I'm using a laptop up at PCAVs just now because, as you know, my own iPad doesn't allow me to enter these meetings where they're live streamed, and it keeps flashing up. Do you want to restart now or in 1 hour's time? So I've just been clicking on 1 hour's time. I was just to say to Eric, if I gave him an option, you know, just to click on the hour ahead or something like that. You know, it seems to be working for me anyway, so just to let him know, but he's gone.
Well, I think, Maureen, I think some of us have other difficulties as well. At least you can see who's in the room. Can I suggest, Gordon, through yourself here, is that we take a break for, say, 10 minutes and then come back to the finance, the Tayside Integration Joint Board Risk Management Strategy. Would that...
Vice Chair,
with that?
Sorry to interrupt, but I did say that Sarah Dickey's been waiting to make a comment for a little while now. I think it probably could be seen as the final comment on this item, and then we can maybe stop.
I'm grateful for that. Thank you. Sarah.
Thank you very much, Vice Chair. Thank you, Chief Officer. It was really just in respect to your earlier comment, Chief Officer, in regard to responsibilities and accountabilities of both the NHS Tayside Board, Medical and Nurse Director, and also in respect to the roles and responsibilities that myself and Dr. Lee Robertson undertake, and it's just to give a commitment to work with colleagues and welcome the opportunity to work in a development session to clarify any confusion in regard to those roles and responsibilities. Thank you.
Thank you very much indeed. Unless there are any other questions, I would now like to take a 10-minute break. Is that agreed? Gordon, you'll have to tell me.
Yeah, no, there's no dissent to that. I think we need to just remind people not to speak while we're in recess on the camera. It will still be live, and I would propose that we come back at 13 minutes past if people want to take that 10 minutes. Thank you very much.
Okay, thank you very much indeed. Does this line stay open, Gordon, this telephone line, do you know?
Yeah, it should do. If you just hang on, Bob.
Just to say I'm back, by the way. Hello.
Okay.
Well, we're all taking 10 minutes now, Councillor Drysdale.
Okay, thanks. Okay, thanks everybody, and I hope everybody's managed to get back. Bob, thank you for taking the chair. Did we manage to finish that last item?
Yes, thank you, Eric.
No, thanks a lot. As you know, it may happen again towards the end of the meeting, Bob. So
that's less of an issue, Chair. Thank you.
No, thank you. Cheers. Okay, so item 6.2 on the agenda, therefore, is the Tayside Integration Joint Board Risk Management Strategy. And again, I would ask Gordon to speak to that report, please.
Thank you very much, Chair. I shall be brief in anticipation that members will have had the opportunity to read the report and the accompanying document, and also to recognise each of the IGBs has been asked to consider this document in the course of their deliberations. So the purpose of this report is to recommend approval of a revised Tayside IGB risk management strategy. Members considered the Perth and Kinross IGB Strategic Risk Register at the Audit and Performance Committee in February this year. This was very well received, with the robust and transparent approach taken noted as representing best practice. An updated strategic risk register will come forward to the June Audit and Performance Committee, along with a risk improvement plan which will set out the further key actions that will be prioritised to further mitigate specific strategic risks. In parallel, this report represents the work that's been underway in partnership with Tayside local authorities and NHS Tayside to revise the Tayside risk management strategy, which was originally approved by the IGB in 2016. This version importantly updates and reflects on our subsequent learning. There are perhaps two sections of the strategy which I would highlight, and the first one is 1.4, which I think visually articulates the respective accountabilities of partner bodies and the IGB's role in respect of risk management. Accountability and responsibility for risk is an area that often causes confusion.
You're cracking up, Gordon.
Sorry, Chair. I was kicked out there. Am I back in okay?
Your voice was distorted. I wouldn't say you were cracking up, but I know what, what Norman meant. Thank you.
Sorry, I got a message to say that I'd been put out the call, actually. So if you can hear me now, I was just highlighting that section 1.4 is probably worth reflecting on because it talks about the accountabilities and responsibility for risk. But also secondly, section 2.4, which describes the importance of establishing the IGB's risk appetite. As members of the Audit and Performance Committee will recall, in February it was agreed that an IGB development session should be convened to consider risk appetite, and this is now being scheduled. One final note is to convey to the IGB that both Angus and Dundee have approved the Tayside risk management strategy this week, with both of them also agreeing follow-up development sessions in respect of risk appetite. So I would ask IGB members to approve this strategy and to commission Perth and Kinross Health and Social Care Partnership to update our strategy in response to the Tayside-wide strategy. Thank you, Chair.
Thanks, Gordon. And now, if I can ask if there are any questions now. It was all going so well, but now I see that my meeting chat is muted. Oh no, there it's come back. It's okay. We're all good. And Ronnie Erskine, you have a question, Ronnie.
Thanks, Eric. You're doing heroically well there. It's a really good document, Gordon. Thanks. It's obviously been well thought through across Tayside, and it captures a lot of great stuff. And you've reminded me in your comment on risk appetite that we've got a debate to come on that. I guess I had two. I don't know if it was a question or a comment, but under 4.1 in the attached document, it talks about IGBs and/or committees. I just wondered if we were, as part of this document, going to be reconsidering the way that we look at risk across the Audit and Performance Committee and Board, or whether we're quite happy just to keep that as is. Probably more substantively on the partner body side of it. I know how difficult it can be to make sure you report the right thing in the right place, and we'll have to, I guess I'm looking for some assurance that we'll be able to coordinate with Perth and Kinross Council and NHS Tayside effectively, so that we are reporting on the right risks in the right place. So it's just those 2 points.
Jane's put her camera on. I'd be grateful if maybe she could come in and answer those, if that's possible.
In terms of the right place for the strategic overview of the risk register, I think that's one for members themselves to give consideration to, and I wouldn't want to, make any comment really. I think members need to work out whether the Audit and Performance Committee, alone takes oversight, or whether there's a role for the IJB. In relation to the question of the right place at the right time, there's been full membership of what is now a Tayside Risk Management Group of all local authorities, NHS Tayside and the Health and Social Care Partnerships, and I think that in itself and the continual meetings will take oversight to make sure that exactly what you're saying, Ronnie, actually happens in practice, that we have operational risks being reported to the partner bodies, we have strategic risks reported to the IJB, and where there's a crossover, where operational risks are such that they are becoming strategic or are likely to impact on strategic objectives, that's the key. That's where regular discussions are going to make sure that we get operational risks escalated, so that IGB members can understand those and are assured of the mitigations. So I think there is still work to do around that crossover, and I think that whole discussion we've just had around clinical care governance, I think I would ask members to reflect on what's in this document in relation to clinical care governance, where I think we should only be interested as an IJB in those risks that are so significant as clinical care governance risks that they are escalated for IJB oversight. I would ask members to reflect on that, because this is about all risk, this document, but the reassurance I would give you, Ronnie, is we have a group that will meet regularly to try to embrace and implement what's in the strategy.
I think that's really helpful, Jane. I'm also conscious, having been quite heavily involved in strategic risk discussions at NHS Tayside, that there will also be strategic risks for the partner bodies as well as the IJB. So I suspect this will be a journey that will probably never end. But I'm glad we're on it. Thanks.
Okay, thank you. There don't appear to be any further questions. So can we agree to note this report? Thank you. Thanks very much.
Sorry.
Yes,
Are we not asked to approve the report?
I beg your pardon. You're quite right. You're quite right, Ronnie. I do apologise. Can we agree to approve the report? I shall take, if anyone's otherwise minded, please speak. Otherwise, I'll take it. We are agreed. Okay, we are agreed. Thank you. Moving on to, therefore, item 7.1, which is the 2021 financial position, and I'd ask Jane Smith, our Chief Financial Officer, to give a report. Thank you, Jane.
Thank you, Chair. If I would just firstly remind members that at the last meeting of the IJB, we were reporting a forecast underspend on our core position of £2.5 million, mainly driven by underspends across social care. Today's report, based on the 11 months to February, sets out an increased underspend that's now sitting at 3.1 million for our core position, with further increased underspends across both health and social care. Appendix 1 highlights the material areas of underspend. I would just take the opportunity to note that we have picked up a small error in one of our formulas in relation to the budget column for the total health and social care budget, but it does not in any way impact on the position presented today, but we will circulate that to members after this meeting. I would like to take the opportunity to focus on Appendix 4 in the report, which is our IJB reserves position. At the last report to the IJB, we were forecasting at that point a closing balance of reserves of 1.8 million. And members will note that that's increased significantly to 6.6 million. There are two key reasons for that significant increase. Firstly, the transfer back of £1.6 million of allocations previously held by the Scottish Government on behalf of all IJBs in Scotland in relation to Primary Care Improvement Fund and ADP funds. This is a change in the kind of financial management of funds by the Scottish Government, who previously wanted to hold these funds for their own cash flow purposes, and they're now being passed out to partnerships across Scotland to manage. Secondly, the finalisation of COVID funding. As previously reported to the board, we have received significantly more funding than our expenditure required for 2021, and the funding that we've received has gone up from 1 million to 3.9 million, and that in itself has meant a significant increase in the forecast reserves that we are holding at the year end. I have to say that we're anticipating a further increase beyond the 6.6 million on the back of further allocations that have come out from the Scottish Government for things like the Community Living Change Fund, district nursing funding, drugs death funding, all of which have come out in last financial year, will feature in our reserves, and we'll carry those forward. What I would say to IJB members is give them assurance that a full and detailed report on reserves will be provided to the board at its June meeting, and reporting on reserves during this new financial year will increase significantly, will be robust and will be transparent, and will be a key priority for myself and for the finance team moving forward. Just in relation to COVID costs, the forecast cost of COVID at month 11 remain the same as they were in the previous report. £8.8 million of costs as a result of COVID, offset by £12.2 million of funds, with additional excess funds of £3.9 million being carried forward, and that was recognised in the budget for 21-22 approved by the IJB on the 31st of March, and those funds being used to support 21-22 COVID costs. I'm very happy to take any questions on the detail of the report.
Thanks, Jane, and as always, if anyone has a question for Jane, if you can put Q in the chat, and we'll give a few seconds for that to happen. Okay, and the first question is Ronnie Erskine. Ronnie.
Thanks, Eric, and thanks, Jane, for the report. It's a very positive report. I think there's nothing in it of any great alarm as far as I can see. I just had a couple of questions, or firstly a point for clarification maybe. You talked about the change in approach to reserves in paragraph 6.2. Does that make any difference at all to what we're doing on the ground, or is it more of a technical adjustment? That was my first question, really. And secondly, in Appendix 3, you've helpfully set out, and we've seen this elsewhere, I think, as well, the savings and the projected outcome against what was planned and some of the gaps there. Did you want to say anything, at a high level around what we might be doing to try and deal with any of those shortfalls or gaps that are in that appendix?
Thank you, Ronnie, for both questions. First of all, in relation to reserves, yes, it's a technical adjustment by the Scottish Government. In some ways, it's actually, I think, more transparent that the IGB members can see the totality of slippage in funds. But I guess the other risk that it raises, more from a looking ahead to this year, in terms of the sheer scale of money being passed to us by the Scottish Government, which in itself is positive, but for us as a partnership, I suppose it demonstrates the scale of transformation expectation that's been put on us to deliver in 12 months, and that in itself, I think the reserves position, should signify perhaps a risk to IGB members around our capacity to deliver on all that's being expected of us. And you will undoubtedly come back and challenge why we're not spending our reserves. And I suppose I'm saying at an early stage, it's going to be a real challenge to have the capacity to deliver on all that's being asked of us in response to COVID, directly, remobilisation and wider transformation. And that links nicely onto the delivery of savings, because on top of all of that, we are going to have to deliver against those savings plans which have slipped. And the slippage has been built into our 21-22 budget, as you'll recall. But Gordon may wish to come in. We've got some significant time set aside as a management team starting on Monday to look to prioritise transformation, and particularly where it requires to deliver savings. And we'll be able to provide further assurance in June around our plans to ensure that savings can now be delivered in line with plan, where it's still seen as in line with strategic plan and through the lens of COVID. So that is absolutely work in progress and at the top of our list as a management team.
Thanks, Jane. It's pretty much what I expected you to say. I didn't think you would say everything's going to be straightforward. So thanks for that.
Okay, thank you. And again, there do not appear to be any further questions. Are there any comments? Oh, there is a question now from Sandra.
Thank you, Chair. I note, as very often when there's a financial report being presented to IGB, that prescribing is always one of the key issues as far as Perth and Kinross and many other IGBs is concerned. I just wonder if that's a topic that it would be worthwhile having a report presented to the board on, and to look at, is there anything more that we could be doing as an IGB to lessen the impact of medicines prescribing?
Thank you, Sandra. I'm just trying to recall, I think it may have been at the last meeting in response to a very robust challenge from Pat around the work that we're doing locally around efficient, safe and effective prescribing, and there was an agreement at that meeting to bring forward a paper. Hamish may want to come in, but I think the timing of that paper will be key, because many of our GPs are still remobilising and are supporting the vaccination programme. Hamish, I don't know if you want to say anything around the proposed timing of a paper coming forward.
Yeah, I think it was agreed that the paper come forward towards the end of the year. I think there's a sense that we had very good general practice engagement with a lot of the initiatives that we were undertaking around prescribing, both in terms of cost effectiveness and quality. But general practice is a very different place at the moment. The prioritising of having to give more time and space for work, therefore taking on extra additional proactive work like this is a lot more difficult at the moment. So we're very conscious of that and very keen to engage colleagues at the earliest possible moment as we're sort of remobilising.
Okay, so thank you for that, and apologies for having missed that at the as part of the last meeting. Thank you.
No problem at all. Okay, thank you. And we have a question from Maureen. Maureen?
Yes, I would just noticing here that I couldn't see anything about carers money. Is that not included in there, Jane? But in particular, the new money from the Scottish Government for carers, but none of that seems to be mentioned in here. Is that handled separately by the Carer Strategy Group?
So Maureen, this is a report on the 2021 forecast financial position. It's not a report on the budget for this new financial year, and that's where you would have expected to see, more detail about the use of that ring fence funding. So you're right, it's not called out, but that's because it's a report on the 2021 financial year.
I think it's good that you mentioned it was ring fence money, because I don't think it's been treated as such, the new money. But again, this is in a different period of time from what we're discussing now. But it was just interesting that you assumed that it was ring fenced money, because apparently it's not ring fenced, and a lot of the money has been taken to offset services that were provided in the last year during COVID. And there's very little of it left. So.
Maureen, I'm very happy to have that discussion with you offline. The carers funding is absolutely ring fenced to support the cost of implementation of the Carers Act.
Oh,
thank you for that clarity, Jane. Okay, there don't appear to be any further questions, so can we agree to note the 3.107 projected year-end?
You're on mute, Eric.
Oh, great. Sorry. So yeah, there don't appear to be any further questions. Can we agree to note the projected year-end underspend of 3.107 million? The projected year-end surplus in relation to COVID-19, after taking account of confirmed additional Scottish Government funding to be carried forward in an earmarked COVID-19 reserve. And can we also note Jane's update in relation to the IJB reserves position? Is that agreed?
Agreed.
Thank you. Moving on, therefore, to 7.2, an additional item on the agenda, which is a verbal update by Jane Smith on the 21-22 budget. Jane.
Thank you, Chair. In follow-up to approval of the 21-22 budget at the IJB meeting on the 31st of March, further discussions have taken place with Stuart Lyle, the NHS Tayside Director of Finance, in relation to the offer of £1.4 million non-recurring support. I would confirm again to members that if this funding is required in full to support in-year financial balance, then it will not require to be paid back in future years. I can confirm that the funding has now been transferred by NHS Tayside as part of the final 2021 budget being made available to the IJB from NHS Tayside, and it will be carried forward in reserve to support the financial position in line with the financial plan. I am pleased that following the very positive and constructive discussions that we've been having as Chief Financial Officers with Stuart Lyle, that there will be an opportunity for the Perth and Kinross IJB to put forward proposals for the use of the funding should it not be required in full or in part to balance the 21-22 financial position. The Executive Management team are already considering the very valuable opportunity that this may offer us should the funding be used in this way. There will be an expectation of payback to NHS Tayside in future years. So I hope that's a very positive update, and certainly is the result of very productive discussions with Stuart Lyle, and I've no doubt that those discussions that are planned in the diary will continue to provide a very useful forum for bringing forward any proposals once we monitor the financial position and we have an early understanding of whether or not the funding being passed across is going to be required in full or not. I'm happy to take any further questions on that issue.
Thanks, Jane, and thank you for your encouraging update. As you say, it's good good to learn of the dialogue that there has been since the last meeting to clarify any uncertainties. Are there any questions for Jane on this verbal update? Doesn't appear to be. Okay, can we agree to note the report? I take it we're agreed. Thank you. Moving on, therefore, to items for information, for the committee's information. First of all, can we go to 8.1, which is the multi-agency public protection arrangements annual report 1920. Sorry, I'm not entirely sure who's going to be presenting this, if anybody, or if it's just for any questions by exception at this stage.
Chair, I think it was really just for information. If people just want to note it, and it's shared with the Health and Social Care Partnership in the same way as both the MAPA report and the Child Protection report is shared with Council, NHS Board and the respective committees. It may have been for Jackie Pepper to answer any specific questions, but we can perhaps pick them up offline.
Yeah. So, I mean, as I say, these 8.1, 8.2 in particular are for information. But if there are any burning questions, I'm happy to take these. And Sandra, you have one?
So I've got a couple of questions about the report, and just some of there's a couple of charts within the report that have emerged from the reference group meeting earlier this week, just about some of the statistics that are quoted within it. But I'm happy to email them. They might be too specific without Jackie here, so I'm happy to email them in, and they'd be picked up at some other time.
That would be helpful, Sandra. Thank you for that, and I'm sure Jackie can respond to these. It's unfortunate we're all zoomed out, and she's zoomed off to another meeting, so it's just unfortunate that that happened just a few minutes ago. Okay, so can we agree to note item 8.1, the annual report on multi-agency public protection arrangements?
Agreed.
Take it we're agreed on that one. And 8.2, Perth and Kinross Child Protection Committee Standards and Quality Report. Are we agreeing to note that as well?
Can I just add a question, or more of a point, Chair?
Yes, of course, Bob.
I mean, I think this is a very interesting report, and I'm glad that we have it before us. And one of the things I most appreciated was some of the issues about the multi-agency working, particularly the role of Police Scotland, and some of the risk factors that we need to be aware of. But one of the other strong things that's emerged out of the report is the work that's been done on independent advocacy and the digital learning opportunities as well. And I think we should note that, and I think we should also note the reduction of child sexual exploitation figures there, whether that's a meaningful ongoing figure or not. But I think we might have expected more of that matter to be arising, particularly given lockdown, etc. So I really want to compliment the authors on this report.
That's very welcome, Bob. Thank you for that. And yes, these aspects are certainly encouraging. No further comments. So if we can agree to note that report, thank you. So now we move on to item 8.3, which is the forward planner, and obviously we have a bit of an issue with more than one issue in relation to the June meeting, which, as you can see from the chart at 8.3, we might need the whole of June, never mind just the 30th, to go through all of that. So we need to speak about that. So I'll just ask Gordon to comment, please. Gordon.
Yes, Chair, thank you. No, it feels as if we've got a substantive amount of business that we need to carry out, we need to progress in June. I'm minded of Ronnie Erskine's earlier comments that actually what we might need to do, or I would suggest on the basis of what Ronnie said, what we might need to do is to be clear about which of these reports are time critical, which of them are for information and need not perhaps be the subject of discussion at an IJB, which of them require approval or a formal decision. And we need to potentially look at the ways in which we can use the development sessions and also convey some of the information through newsletters or bulletins or circulations. So we'll meet and look at the pressures in that agenda. It's potential that we could also think about introducing a further development session in July or at some point, although recognising that Council will be in recess and some people will be looking to be taking annual leave, as indeed I will. But we'll apply these various considerations to come up with a revised programme and have a discussion with the Chair and Vice Chair about which reports will be presented when and what might be dealt with in different ways. I think that's the best we can do at this juncture. And part of it, I suppose, has been very clear about making the best use of IJB time in relation to where decisions are needed, strategic direction is being set, or proposals require approval. So that's how we would intend to proceed.
Seems to be muting itself again. I do apologise. Ronnie, I see you just put a comment in the chat. Do you just want to comment just now? I haven't actually read what you've said, but
yes, thanks, Eric. It helps. I was going to mention a follow-on point anyway, but I just would completely agree with Gordon's suggestion there that, and I know you have a pre-planning meeting, which you try and map out what the best approaches are. I think Eric might be struggling with his device. Are you?
You're right. I am. I'm
You're
not going to touch it again.
Throw something at the screen, I think. But I think, yeah, maybe some things by email, offline, by note, or in the meeting, or even deferring some. So obviously, you're happy to defer to your better judgment on those things. I wouldn't really want to spend the whole of June in a meeting, much as I do enjoy IJB meetings. If I could make just a quick follow-up point, it was just on the items we discussed earlier today on the budget for 21-22 and also the strategic risk management. It might be that it would be worth having a look again at which committees we need to report these to. We might find we might need to add another tick or two over the year as a whole. I'm not suggesting June, but depending on developments. Thanks.
No, thank you. My computer's taken on a life of its own, unfortunately. I'm not touching it, but it's doing all sorts of things. So I do apologise if I miss any comments here in the chat. I don't think there are any further comments, but if there are, if you can just unmute your microphone, please, and just any further comments that anybody has, I'll give a few seconds for that. Is there anybody? Don't think so. And if anybody knows an IT expert, get them to give me a ring, please. But no, thank you for that. So we note the forward planner and the activity that will be undertaken in order to manage the agendas of both the IJB and the future development sessions accordingly. Thank you. Therefore, the final item on today's agenda is just to note the dates for future IJB meetings and development sessions. And if I can just ask you to note your diaries accordingly, that would be helpful. If there is any need to adjust any of these dates, then clearly we will look to advise the board of that at the earliest possible opportunity. What on earth is going on with my computer? I don't know, but I did see a queue coming up from Sandra there. Sandra, do you have a question?
I do have. So would like to acknowledge the improvement that's been made in the committee papers coming out in a much kind of more timely fashion, and so that's really appreciated. A couple of comments again that came from the reference group this week were in relation to the language which is used within the committee papers. And whilst I think there's almost a tradition in the way that the papers are written, I just wonder if it's possible over time as we move forward to sort of maybe pay a wee bit more attention as to the readability of them by particularly interested members of the public, and where we're looking for a bit more input into the work of the IJB, just how understandable in the use of some of the acronyms and just some of the language. So to end a Friday afternoon, I just leave you with that thought. I just wonder if that's something that maybe could be given some thought.
Well, thank you for that, Sandra. And yeah, plain English, I know is something that we all endeavour to communicate in, and I'm sure officers have noted these observations, and will try to ensure that that their reports are as minimum in terms of acronyms and technical jargon and as plain as they can be. But I have to say that I find the reports very easy to understand, most of them, but yeah, I mean, to the observer, clearly it's important that they are expressed as plainly as they can be. But no, thank you for your comments, Sandra, and I don't think there are any further comments there, but I really don't know because of this. So
Chair, if I could just thank Chris for your ICT people for trying to do their best to help me to get in today, to no avail, sadly, but I just want to thank them personally.
No, that's welcome. Thanks, Bob. And perhaps, as I said, IT people can stay on the call afterwards to help me. That would be good. But thank you, everybody, for your attendance this afternoon and your active participation, as always. And I wish you a nice spring evening and a joyous weekend at whatever you're doing. Good afternoon, everybody. Thank you.